7 Diabetes emergency signs you must know. Diabetes is a widespread condition, impacting millions worldwide. It often manifests with subtle signs that require careful attention. Nevertheless, there are specific emergency indicators that can signal a potentially life-threatening situation. Recognizing these signs can be the key to prompt, effective intervention and averting severe health consequences. In this video, we'll discuss 7 diabetes emergency signs you must know. Whether diagnosed with the condition or not, you need this knowledge. Stay informed and prepared to tackle these emergencies to protect your health or the well-being of those around you. Number 1. Hypoglycemia. This occurs when the level of glucose, sugar, in your blood drops below the normal range. For people with diabetes, this can happen when too much insulin is in the bloodstream or when not enough food is consumed to match the insulin dosage. Hypoglycemia can manifest in various ways. Here are some of the most common symptoms to watch out for. Shaking or trembling. You may notice sudden tremors or shaking, especially in your hands. Rapid heartbeat. Your heart may race, making you feel anxious or jittery. Sweating. Profuse sweating, even in cool conditions, is a typical sign. Irritability or confusion. You might become easily irritable, anxious, or confused. Dizziness. Feeling lightheaded or dizzy is another common symptom. If you or someone you know experiences these symptoms, it's crucial to act quickly, to raise blood sugar levels immediately by consuming fast-acting carbohydrates like fruit juice or glucose tablets. Hypoglycemia is a serious condition that requires prompt action. Knowing the symptoms and how to respond can make all the difference. Number 2. Hyperglycemia. Picture your bloodstream as a bustling highway. Now, imagine it jam-packed with glucose, the fuel of your body. That's hyperglycemia, when there's too much glucose on the road. It can happen when your body doesn't have enough traffic cops, which is insulin, or when the roads, which are your cells, are clogged. Hyperglycemia is a common concern in diabetes, both type 1 and type 2, and understanding it thoroughly is crucial. High blood sugar levels can have a profound impact on your body's functioning, and it's not merely a minor issue for individuals with diabetes. It can manifest in various ways, and these symptoms often serve as warning signs that something isn't quite right. Signs of hyperglycemia can include excessive thirst, frequent urination, fatigue, and blurry vision. If left untreated, while these symptoms alone can be distressing, it's crucial to understand the potential dangers of uncontrolled hyperglycemia. Left untreated, hyperglycemia can escalate into a life-threatening condition known as diabetic ketoacidosis, commonly abbreviated as DKA. Managing blood sugar levels through insulin or other medications is essential in this case. Number 3. Diabetic ketoacidosis, DKA. DKA is a complication primarily seen in people with type 1 diabetes. DKA isn't your everyday diabetes issue. It's the grand finale of complications, a cascade of events that can be life-threatening. Picture this. Your blood sugar levels are soaring to unprecedented heights, and your body's chemistry starts to resemble a wild science experiment gone awry. That's DKA in action. DKA isn't merely a collection of symptoms. It's a narrative of your body's response to extreme hyperglycemia. When your cells are starving for glucose due to a lack of insulin, they turn to fat for energy. This metabolic switch releases acidic substances called ketones into your bloodstream. Ketones, while essential for energy production, can turn into a double-edged sword when they accumulate excessively. As ketones build up, they make your blood more acidic, a condition known as acidosis. This sharp drop in pH can lead to a series of life-threatening complications, affecting your vital organs. DKA is a thriller where the stakes are high and the plot unfolds rapidly. If left untreated, it can lead to severe dehydration, electrolyte imbalances, and potential damage to your heart, kidneys, and brain. It's a race against time. Symptoms include deep, labored breathing, fruity breath odor, and abdominal pain. DKA can also affect cognitive function, leading to confusion, disorientation, and an altered mental state. When you suspect DKA, time is of the essence. Don't play the waiting game. Seek medical help promptly. The sooner you act, the better the chances of a favorable outcome. If you found this information valuable, don't forget to hit that like button, share this video with others who might benefit, and of course, subscribe for more content on health and wellness. Number 4. Hyperosmolar hyperglycemic state, HHS. HHS typically occurs when blood sugar levels surge to extreme heights, causing your blood to become thick and syrupy. Your body attempts to eliminate excess sugar through frequent urination, leading to severe dehydration. This condition mostly affects people with type 2 diabetes. Signs include extreme dehydration, confusion, and seizures. The consequences of HHS are no light matter. It can lead to complications such as seizures, coma, and even organ failure if not addressed promptly. Like DKA, HHS is a medical emergency that requires prompt intervention. Number 5. Hypoglycemic unawareness. This is like a sneaky spy. It hides the warning signs of low blood sugar from you. This means you may not recognize when your blood sugar levels are dropping dangerously low until it's too late. Some individuals with diabetes may lose the ability to sense when their blood sugar drops dangerously low. This can lead to severe hypoglycemia without warning. It's not just a minor inconvenience, it's a safety concern. Hypoglycemia unawareness can lead to severe low blood sugar episodes that may result in accidents or other complications. Frequent blood sugar monitoring and working with a healthcare provider to adjust treatment are essential for managing this condition. Number 6. Severe hyperglycemia. This represents a critical imbalance in blood glucose levels. It occurs when blood sugar levels surge to perilous highs, frequently exceeding 250 milligrams per deciliter and sometimes reaching far higher levels. This emergency arises from a shortage of insulin, leading to an inability to regulate blood sugar effectively. Severe hyperglycemia stands as a grave diabetic emergency that requires awareness, prompt recognition, and decisive action. By understanding and recognizing its symptoms and responding with the appropriate steps, individuals with diabetes can navigate this critical situation and protect their well-being. Severe hyperglycemia isn't a mere inconvenience. It's a full-scale blood sugar crisis. To navigate this emergency, we must grasp its underlying causes and the intricate interplay of factors that drive blood sugar levels to precarious heights. This includes symptoms like extreme fatigue, nausea, vomiting, and difficulty breathing. Don't ignore these signs. They can indicate a life-threatening situation. Number 7. Severe hypoglycemia. This isn't your typical blood sugar dip. It's an intense drama that unfolds when your blood sugar levels plummet to perilous lows. It's important to recognize the severity of the situation, especially when compared to milder cases of hypoglycemia, as the response here is more urgent and potentially life-saving, which can result in unconsciousness or seizures. Severe hypoglycemia is a high-stakes game where the clock is ticking. Knowing how to recognize it and respond effectively can be the difference between a positive outcome and a potentially life-threatening event. If you encounter someone experiencing severe hypoglycemia, it's critical to administer glucagon or call the emergency line immediately. In conclusion, being aware of these 7 diabetes emergency signs is vital for everyone, whether you have diabetes or not. By understanding these symptoms and knowing how to respond, you can potentially save a life. We hope this video has been informative and encourages you to share this knowledge with others. Remember, awareness is the first step towards a safer and healthier future. If you found this information to be of value, don't forget to give us a thumbs up, subscribe, and click the notification bell to stay informed about our forthcoming videos dedicated to your health. Until we meet again, prioritize your well-being.